Okay, so now it's the time to get started with the session. So I welcome you all to LMHI 2021 Global Colloquium. I would also like to acknowledge our session coordinators, moderators, as well as chairpersons. Starting with session coordinators, we have Gauri Chawla and Srishti Sudan. I also welcome Dr. Cheshta and Dr. B. Thankraj as our moderators for the session. I request our moderator to invite our chairpersons and take over the dais. Over to you, Doctor. Thank you.
Thank you, Surbi. Good morning, good afternoon, good evening, according to the various time zones across the globe. Welcome everyone to the LMHI Global Colloquium 2021. We all have experienced an unprecedented situation with the global COVID-19 pandemic. Everybody, everywhere, the immediate needs of this public health crisis has arisen. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID complications. Post-COVID conditions are a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after the first being infected with the virus that causes COVID-19. These conditions can present as different types and combinations of health problems for different lengths of time. The speakers of this session share their experience in management of long COVID with homeopathy. So today, I welcome all the speakers, and the session would be chaired by Dr. Thankaraj.
Thank you, Dr. Cheshta.
Welcome, sir.
Thank you,
Dr.
Cheshta.
Thankaraj is an associate professor at Nehru Homeopathic Medical College and Hospital, Delhi.
Thank you, Dr. Cheshta. We can call upon our first speaker.
Yes, sir. So with your permission, I would like to call upon our first speaker.
Doctor.
So since we have lost a connection with Dr. Aditi, no worries, she'll be presenting next. With the permission of the chair, sir, can we go ahead with our next speaker?
Yes, Dr. Cheshta.
Okay, sure, sir. So next we have Dr. Nadezhda from Moscow, Russia. And she's actually placed at the City Clinical Hospital in the Department of Health, Moscow. And the title of her presentation is The Case of Treatment of a Guillain-Barré Syndrome Caused by SARS-CoV-2 Virus. And welcome, Dr. Nadezhda.
Yes, good morning.
Dear colleagues, I'm very grateful for the opportunity to represent you with a case of COVID-19 treatment complicated with Guillain-Barré syndrome. Guillain-Barré syndrome is currently the most frequent cause of acute flaccid paralysis, being an autoimmune disorder wherein demyelination of the peripheral nerves occurs. Its main clinical features are symmetrical ascending muscle weakness with reduced osteotendinous reflexes and various sensory involvement. GBS most commonly occurs after an infection, especially viral, including COVID-19, but may also transpire after immunization with certain vaccines. Immunoglobulins, plasmapheresis, and glucocorticoids represent the principal treatment modalities. However, the patients with severe disease progression may require supportive therapy at an intensive care unit. Guillain-Barré syndrome occurs worldwide at an incidence of 1.1 to 100,000 people. GBS prevalence was estimated at 15 cases per 100,000 people with SARS-CoV-2 infections. GBS is associated with the COVID-19 and is its potential complication. Guillain-Barré syndrome may be developed in sick patients as well as in vaccinated ones. Neurological symptoms may occur during the period after getting the COVID vaccine. The latency between vaccination and GBS initiation ranged from 3 hours to 39 days. Neurological symptoms associated with the COVID-19 are observed in 36.4% of cases in the first 3 weeks of the disease. COVID-19, complicated by Guillain-Barré syndrome, increases the risk of long-term respiratory failure and mortality in general. The most common neurological side effects of SARS-CoV-2 vaccines are headache, Guillain-Barré syndrome, venous sinus thrombosis, and transverse myelitis. Healthcare providers should be aware of potential adverse reactions from SARS-CoV-2 vaccination. GBS can occur after the first dose, within 2 weeks, or after the second dose of the vaccine. There are descriptions of such cases from Mexico, Korea, USA, India, Malta, Taiwan, Tunisia, Italy, Austria, Brazil, England, Australia, and Russia. In 91% of cases, GBS arises with SARS-CoV-2. Published research usually report the classic sensory motor type of GBS in SARS-CoV-2. Approximately a third of patients require mechanical ventilation of lungs and an intensive care unit. Mortality rates among patients with GBS arising from COVID-19 are quite high, from 3.5% to 10.8%. The therapeutic approach included intravenous immunoglobulin, 0.4 gram per kilo for 5 days, which resulted in the improvement of neurological symptoms. Most patients were treated with a single course of intravenous immunoglobulin. Neurological outcome was favorable in 64.6%. Improvement is usually noticed within from 6 weeks to 6 months in most cases. COVID-19, which often causes a severe acute respiratory syndrome, can lead to various neurological complications, including GBS. Treatment of respiratory and gastrointestinal manifestations of SARS-CoV-2, homeopathic medicines included, is well described, but management cases of patients with neurological complications are still rare. We'd like to represent you with a case of homeopathic treatment of COVID-19 complicated with Guillain-Barré syndrome. A 50-year-old woman was examined on an outpatient basis. An oropharyngeal swab on SARS-CoV-2 gave a positive result. According to the result of the computed tomography chest scan, the patient was diagnosed with polysegmental viral pneumonia on the 3rd day of illness. On the 16th day of illness, the patient developed symptoms of acute progressive symmetrical sluggish ascending tetraparesis, the GBS. This was confirmed by the result of neurological examination and also by the magnetic resonance imaging of the brain and spine. Here is the conclusion of a neurologist confirming the patient's Guillain-Barré syndrome, the results of the CT scan of the chest, and the results of a blood test. So the case history. On the 28th of August, there were the first signs of acute respiratory viral infections. The temperature was understood to 37.5, weakness, increased blood pressure, vertigo when standing up. A PCR nasopharyngeal swab confirmed the diagnosis of COVID-19. On the 9th of September, unexpectedly, the condition got worse. It became hard to breathe, numbness appeared on the toes and left foot and the first phalange of fingers. Weakness increased. At night after 1 a.m., her back began to hurt regularly. When the temperature dropped, there was weakness in both legs and numbness on the tailbone. Then herpetic eruptions appeared on the tailbone. On the 13th of September, she could not walk anymore. From that moment on, every night from 2 a.m., severe pains in the spine occurred. The pains were diminished from hyperextension of the back when stretching the top of the head to the coccyx. On the 14th of September, she could not sit down. From the 15th to the 16th of September and onwards, she could not sleep due to the back pain. She began to inject analgesics with an effect lasted only for 3 hours. She practically stopped sleeping. Panic attacks appeared. Numbness in both legs increased in the area from foot to the knee. On the 17th of September, the PCR test was negative. The pains at night became unbearable and were not removed by injections of ketanol and other analgesics. On the 18th of September, she was almost without sleep for 3 nights. On the 19th of September, a neurologist diagnosed Guillain-Barré syndrome. The amateur investigation of the entire spine was done. From this point on, the patient turned to a homeopath. A survey was conducted, taking into repertory of the following symptoms. This slide represents the symptoms taken to repertorization after the survey, and Arsenicum album is on the first place of repertorization. The selected and prescribed remedy was Arsenicum album C200 in frequent repetitions in solution every 3 hours, quickly reduced neurological symptoms. The patient got to her feet and was able to walk after 12 days from the beginning of taking the homeopathic medicine. The clinical picture of Guillain-Barré syndrome began to develop from the 16th day of coronavirus infection. There were no difficult respiratory symptoms despite the ground glass lung lesion on CT. The patient on a homeopathic treatment, matched by a combination of symptoms, gave a quick positive trend within 1.5 weeks. As it was prescribed by a neurologist, she received Perletion 600, Neuromidine, and acetylcarnitine. Due to the refusal to be admitted to the COVID hospital, she did not receive immunoglobulin and plasmapheresis. The patient was able to sit up on her own after 3 days. Pain decreased in spine significantly after 1.5 days. Strength in the legs trying to stand up appeared after 5 days. On the 6th day, she put together a puzzle. Fine motor skills appeared. Deep reflexes recovered after 8 days from the start of taking the drug, and she was able to move from the bed to chair. On the 10th day, she began to get up. She began to walk on the 12th day from the moment of taking the drug. According to the literature, a decrease in neurological symptoms is noted from 6 weeks to 6 months. The medical record of the patient with GBS on the background of COVID-19 complements the cases already described in the literature that indicate that SARS-CoV-2 causes GBS. Nowadays, it is important to pay attention that neurological disorders can be the leading symptoms of the cause of SARS-CoV-2 infection. The presented case demonstrates that the patient with COVID-19 complicated with development of GBS may not show clinically significant respiratory symptoms. A properly selected homeopathic remedy chosen by a totality of symptoms leads to a rapid regression of neurological manifestations and recovery. This example clearly shows that Arsenicum album, which proved to be one of the leading remedy in the treatment of pulmonary pathology caused by COVID-19, also worked well with neurological symptoms caused by COVID. We also observe a high efficiency of homeopathic treatment compared to allopathic. GBS was cured in 12 days, whereas according to the conventional medicine, the recovery time is from 6 weeks to 6 months. Thank you for your attention.
Also, I'm thankful for the invitation to participate in the colloquium. Many thanks to the Liga and all the organizers of this amazing event. And a special thanks to India, Dr. Manchanda and his team for such a big work done, support and attention to each participant of the colloquium.
Thank you.
Thank you, Dr. Naridza, for sharing such a beautiful case wherein neurological complications which can be there in COVID-19. Such cases were reported from different parts of the world too, but they were quite sporadic. Thank you for sharing such a case wherein the recovery was seen in a span of 12 days only. Now, I would like to request our chair if he wants to ask some questions to the doctor.
Dr. Nashtita, could you please tell me the indications on which you prescribe arsenic and to this patient?
Pardon, you please tell more slowly because it's rather hard to work out the accents.
Indications of arsenic album that you prescribe. So could you tell me what are the indications of the arsenic album in this patient?
A question for organizers. Could you please give an opportunity to speak for our translator?
Is there any translator available?
Yes.
Yes, she can go ahead and speak. I think we can put the question in the chat box and Dr. Nadezza can answer it there and then we can share it with everyone.
Mm-hmm.
I think that would be a good option.
Okay. Yeah. So then we can go to the next speaker.
Okay. Meanwhile, I think we have been joined by Professor Dr. Rajat Chattopadhyay.
Okay. Okay, so let me invite invite him for sharing the session. Dr. Rajat, good morning, sir.
Yeah. Morning.
This is Dr. Thangaraj.
Yeah.
So, Dr. Rajat Chattopadhyay is the principal and administrator of Calcutta Homeopathy Medical College. This is one of the oldest homeopathic institution in Asia that has been established way back in 1880. Welcome you, sir, and welcome to the session. Welcome, sir.
So
you can share the session, and now you can share the session. Sir.
Now we may call upon our next speaker, Dr. Aditi Arun. Dr. Aditi?
Yeah, thank you, ma'am. And sorry for the inconvenience.
Oh, no, not at all. You can go ahead with your presentation now.
My respect goes to the chairperson, all moderators, coordinators, my fellow speakers, and all the delegates. Without much delay, I'll just start with my presentation. So the topic of my discussion for today is long COVID-19, its homeopathic management, and experience quoted by my senior Dr. A.K. Arun. Just a brief about what long COVID-19 is. It is a condition characterized by sequelae appearing or persisting after a typical convalescence of COVID-19. Long COVID can affect nearly every organ, be it your respiratory disorders, nervous system, neurocognitive disorders, musculoskeletal, anemia, malaise, and everything. So just a second. Here is a symptom timeline. So if you look at this, you will understand that how COVID-19 positive patients, once they have been treated and got cured, eventually weeks later and months later was again fall prey of few sign and symptoms, which were, in a way were carry forward from the previous disease. So we term those conditions as a long COVID condition. This is a graphical representation, a pictorial representation rather, that how acute COVID infection within, if it is still persisting for more than 4 weeks to 12 weeks, is shifting towards a long COVID cases. The common symptoms include fatigue, headache, chest pain, diarrhea, recurrent rashes, fever, shortness of breath, and everything. These post-COVID complications were seen in the cases in the people who were earlier having mild to moderate COVID infection. And then more serious patients who were having severe to critical COVID infection in the past are coming up with more serious complications like inflammation of heart muscles, respiratory disorders, dermatologic disorders, neurologic and psychiatric disorders. Here I'm showing you again a graphical pictorial representation of what all organs can be and are affected post-COVID, their symptoms and the variables which are need to be monitored if a case of such long COVID enters your clinic or a doorstep. Then we in Dr. Arun's clinic, we were taking certain cases and it was an observation that those cases who were previously cured, were now coming up with another set of symptoms like post-traumatic stress disorder, post-intensive care syndrome, mucormycosis, multisystem inflammation syndrome, especially in children, pulmonary embolism. These were the cases which were coming back to us, coming back in homeopathy for the treatment. Here I've explained what the complications in a brief. That post-traumatic stress disorder, it is basically a mental health condition that is triggered by a terrifying event. Say this COVID has made us develop a strong fear, a shock by losing our own self, our loved ones, our finances, and everything. So these are the five signs. If you are seeing the altered anxiety state, changing in mood swings and everything, or the patient is experiencing flashbacks or fears or mood swings, you can term those cases, categorize those cases in the post-traumatic stress disorder category. Another set of complication was post-intensive care syndrome. This was majorly seen in cases which were severely ill with COVID, were majorly hospitalized, or were in ICUs. If you see, there was a study done in abroad where 90% of patients were reported affecting of at least one of the major PICS domain. Another set of COVID complication is multi-system inflammatory syndrome in children. This was something new to all of us as the cause is unknown, but the medical experts have observed that children having multi-system inflammatory syndromes were having a strong history of COVID-19. If not, they are having a strong relevance of being present around the people who were initially either COVID suspective or COVID positive. So this was also one of the complications which is commonly seen in other parts of the world as well. Now, directly going back to the cases, I am be showing one or two cases. One of the case is this was a case of a patient. She was a female with a severe headache from past 1 month, which was causing her dimness of vision. And the case was taken in much more detail. I have just kept a summary of this. And the highlights we took for the individualization and the repertorial analysis were the headache, which was very marked, that even rotating her head sometimes was causing her to faint. And there was an observation while the patient entered our clinic, she was constantly blinking her eyes. And to our observation, when we asked, she was like, I can't bear the light behind you. So this was also one of the peculiar symptoms we noted. And the thirst was present. The desires were of lemonade and oranges, kiwi, all the citrus things. The stool was hard. The patient was constipated. On taking the mental journals, she said that she is so sick and the headache is so unbearable that she will die with this type of headache. She's having constant fearful thoughts. Even despite of living in a family, she was always feeling that she'll be alone. There were frequent episodes of mood swings, sometimes laughing and sometimes crying. The patient already was on conventional treatment for a month, but no much improvement was seen. And she also self-took arsenic album 30 for 3 days, but with a no effect. Later, when the patient came to us, on the basis of individualization, stramonium, as you can see on the repertory sheet, stramonium was very strongly indicated, and stramonium 200 was given. After the first follow-up, patient said that she feels slight better, but the frequency of headache is reduced. But again, there was irritability was present, and certain set of symptoms were not treated. So we raised the potency, and by the subsequent second follow-up, she was very happy with the treatment. She quoted actually that I never felt this better in the past few months. So this was one of the case, and as per the rubrics, stramonium was strongly indicated and it did work well. Another case was of a 39-year-old male. He was having persistent cough since past 6 weeks, causing breathlessness, suffocation, choking sensation, and he was unable to lie down and having severe pain in throat. His cough used to get aggravated with strong odors like perfumes, incense sticks, room sprays. On examination, also, the lungs were filled with congestion. On observation, he was always holding his chest while coughing and was breathing very fast. So again, we took the case in detail, and the highlights of the case were he was having dry spasmodic cough with constriction, painful throat with soreness, hoarseness, sipping cold water was giving him relief. So this was one point to be noted. Then mental journals, he was having dreams of fire, wanted his family to look around, was used to get frightened at night. And one of the observation his attendant told us that while dreaming, he screams of experiencing that a relative's accident has happened. And on confirming with the patient, he admitted that yes, very frequently he has having this since he has encountered COVID. He took conventional treatment and was on some sort of syrup, but was not better, was getting a palliative treatment, but as soon as he used to stop the medication, the condition relapsed. So on the basis of repertorization and everything constitutionally, the phosphorus 30 we've given, and after the first follow-up, patient was slight better, but the symptoms were still there, the cough was still there. He was feeling overall better, mentally he was feeling relief, but the physical symptoms were still there. So the potency was raised to 200. And in the subsequent follow-ups, the paroxysm of the cough reduced, sleep improved, the pain in the throat got better. And again, for the subsequent, the dose was repeated, and later he was put on placebo for a month. Now, the purpose of my presentation is that while working with Dr. Akiran in his private clinic, we have experienced these cases. And for the seminar point of view, we have gathered 700 cases of long COVID, like post-COVID complications. And we thought of analyzing those COVID cases, that how well they are responding to the treatment of homeopathy based on the individualization. So the inclusion criteria were all the genders. Specifically, home isolation patients were responding well to the treatment rather than the hospitalized patients. Mild to moderate COVID cases were our priority. Exclusions were pregnant and breastfeeding mothers. Critical cases, as you can see, the demographic representation based on the age and the gender. So 41% of our cases were female patients and remaining were the males. Symptoms identified in the various patients. These are the common symptoms we found out in our patients, say of fatigue, headache, muscle pain, sore throat, frequently loose stool, hair fall, breathing oppressed, loss of smell, loss of taste, vertigo, and general weakness. These were the very frequent symptoms we identified, and on the basis of their frequency, how frequently the cases were there, the graphical representation is being shown to you. Then, talking about the data reporting, total number of cases we took were 700, out of which 17% of the cases dropped the treatment in between, so we don't have their records. We are not considering that. Cases fully enrolled themselves till the end of the treatment were 83%. There are few cases without rubric repertorization, that is for the 21%, and the cases with repertorial analysis are the 62%. And this whole reporting period is from July 2021 to October 2021, basically after the subsiding of the second wave of COVID in India. The time frame, here the graph shows the time frame of suffering from long COVID. So long COVID is basically defined as symptoms persisting from more than 4 weeks to months. So here, around approx 16 to 17% of the patients came to us within the 4 to 6 weeks after getting recovered from the COVID. Then approx 41 to 42% patients were coming to us in the 6th to 10th week, and the remaining 40% cases came 1 month to 1.5 months later for the treatment, as they were already taking conventional treatments. The limitations of our study were that patients taking other conventional drug apart from along with homeopathy for their other lifestyle disorders like thyroid, diabetes, hypertension, their analysis was not been included in the study. And patients who are doing self-medication in between by consuming kada, quath, herbal tablets, which may interfere with the homeopathic drug action, has been included from the case presentation. And then here is the percentage of the disease classification on the basis of their severity. So the cases we encountered, majority of the cases were from mild to moderate COVID survivors. Around approx 19 to 18% of the cases were from severe COVID survivors, and very few were from the critical category, that was hospitalization cases. Out of which, till date, the cases recovered and stopped the treatment were 69%. Cases still undergoing treatment are 14%, and cases doing well but still are put on placebo are 17%. And here's the recovery rate. We took these tops frequently used medicines were phosphorus, spongia, stramonium, pneumococcinum, sulfur, and rockstrol. There are other medicines also which were being administered to the patients as per their symptom similarity, but these are the frequently used medicines in majority of the cases. And this is how phosphorus was, I think, more frequently used. Now talking about the outcomes, the whole purpose of our clinical study, we are not into research. It's just that we have encountered these cases in our clinic and we thought of compiling it for the research purpose. We observed that home isolation cases responded well to homeopathic treatment as there was less drug intervention, which was a plus
Dr.
point for
Aditi,
us.
I'm sorry to interrupt, but would you please wrap up in the
Yes,
next
ma'am,
30
I'm on the
seconds?
last slide. Yeah.
Sure.
And amid all this, there was we saw that homeopathy has a very good scope in cases of a pandemic and epidemic, as the conditions that got really treated well are the mental generals. In other conventional treatments, we don't see uh, the holistic picture, only the physical generals are being taken care of. In homeopathy, from the holistic point of view, the mental generals were also being treated well with homeopathic medicine and the counseling. And constitutional homeopathic remedies were most reliable and faithful in cases of pandemic related symptoms, especially post COVID complications. So yes, it's the conclusion of the whole presentation was this: to establish the efficacy of homeopathy, and yes, we can work well in acute emergencies as well. I would like to thank the panel, and would like to extend my acknowledgement to the Health Minister of Delhi, who was very kind and supporting, to the Director General of Department of Ayush, Dr. R.K. Manchanda sir, to all my patients who have well supported us throughout the treatment, and my fellow team members and my senior Dr. A.K. Arun for this opportunity to work in this pandemic and work something for homeopathy. Thank you so much.
Thank you, Dr. Aditi. It was nice presentation, and it's good to see the cases that have been treated by you. Now, I would like to request Dr. Rajat Chattopadhyay if he has any questions to ask to the speaker.
Oh, it's a nice presentation, Dr. Aditi.
Thank
Just
you.
I want one thing, that as because it is related to our pandemic situation, epidemic situation. So in the post-traumatic stress disorders, or whatever the post you mentioned about PICS, post-inflammatory, all over. So whether have you considered the concept of genus epidemicus, or like of case taking of genus epidemicus, and like arsenicum album was by ministry, it was administered. So in this type of post-traumatic stress disorders or anything, your approach with the genus epidemicus, have you considered ever?
Yes, sir. Yes, sir. We have considered the genus epidemicus. What we found out in our patient, and along with my senior doctor A.K. Arun, there was a feeling of being forsaken and feeling of left alone. So according to our calculation, there was camphora we considered, and majority of the cases were doing well, as we gave camphora as a prophylactic also, and majority of the
Okay.
cases were doing well.
Okay. So as well as individualized, as well as genus epidemicus concept, you have.
Yes.
Thank you, Dr. Aditi. Yeah, wonderful
Dr.
presentation. Yeah.
Thank you, Dr. Rajat. Now we may call upon the next speaker, sir.
Yeah.
Next, I would like to invite Dr. Jitesh TK. Dr. Jitesh is working as Chief Medical Officer, NFSG, with the Directorate of Ayush Homeopathic Wing, Delhi. The topic of his presentation is the effectiveness of homeopathic treatment in post-COVID mental cases, a case series. Over to you, Dr. Jitesh.
Very good morning, everyone. So today I am going to present, my topic is, topic of my presentation is effectiveness of homeopathy treatment in post-COVID-19 mental disorders, a case series. The background of this case series is COVID-19 pandemic has made adverse impact on the mental health of those affected due to constant stressful situations. Life situations. Major contributing factors of these stresses were prolonged lockdowns, social isolation due to quarantine, casualties of dear ones, and lack of access to the health care facilities. Substantial number of the sufferers of a COVID-19 infection after recovery developed new onset mental disorders like anxiety, depression, insomnia, post-traumatic stress disorders, and grief reactions. These were new onset mental disorders because they are considered as a new onset mental disorders because these symptoms were developed only after getting the COVID infection. These patients were not having any symptoms of mental ailments before getting COVID. Homeopathy gives much importance to mental health, and there are sufficient literatures related to psychological illnesses treated with homeopathy. As post-COVID mental disorders is a new scenario, there is a need to study the usefulness of homeopathy treatment in these new onset mental disorders. That is why we had taken this topic for our case series. Then our methodology was 16 cases of first onset mental disorder after recovery in lab confirmed cases of COVID-19 were reported by 9 medical officers posted in different Delhi government dispensaries. Cases consist of patients of both genders and different age groups. Treatment was given for different mental ailments. Individualized medicines were prescribed and cases were followed up regularly for 8 weeks. Selection of potency, dose, and repetition was done as per the instruction of Hahnemann in Organon of Medicine. Assessment of outcome was done by the outcome related to impact of daily living using a 9-point scale for around 8 weeks. These are the patient information. What are the symptoms we had observed in the patients? The chief complaints, main complaint we have noticed are anxiety either related to self or family. That was there in almost all cases. There were many types of fears in these patients. The fear of disease, fear of death, fear of closed room, fear of darkness, fear of mishappening, fear of recovery, fear of being alone, and fear of people. These fears were there in almost around 14 patients. Sadness and depression was there in around 12 cases. Mental restlessness was there in few cases. And mood disorder and insomnia were there in 8 and 10 cases. The other information we had collected are the past history. We had gone through the past history of these patients. There's only one patient was having a history of mental illness prior to this condition. She was having a mild apprehension during the examination time. Then regarding the family history, only one person was having some her father was having a incident of depression that was also for a very short period. Then out of these 16 cases, 12 cases were come to the OPD directly without taking any other treatment, and 4 cases has taken allopathy treatment before taking homeopathic treatment. But this way they didn't get any much relief from the allopathic treatment. These are the prescribing symptoms of individualized medicines and changes into 8 weeks. Each and every case, the prescribing symptoms I had mentioned in this charts, but the time allotted is only 10 minutes. So I am skipping this part. And the important part is the outcome. What the outcome we are seen from this case series. Frequently prescribed medicines are arsenic album in 4 cases, Ignatia amara in 3 cases, stramonium in 2 cases. Other individualized medicines found useful are petroleum in two cases, sorinum, calcareum, tuja, lysinum, cocculus, and hyoscyamus niger. All the cases have shown significant outcome in Oradell scale during this 8 weeks of period. This is represented in this chart. The 9 cases has shown +4 outcome in Oradell scale, and 6 cases +3 outcome, and +2 outcome was there in 1 case. This is a very significant outcome, because any mark above +2 is considered as significant in Oradell scale. The medicines that were in high potency were shown to be more beneficial. Potency was used up to 1 m in 12 cases and up to 200 in 3 cases. In 1 case, only 30C was given. In that case, the 30C has given complete relief for the patient. Most of the cases have recovered in a period of 5 to 8 weeks. The 7 weeks was the average period of recovery. Then what are the takeaways of this case series? The findings suggest that the individualized homeopathy treatment selected by different methodology of prescriptions based on general symptomatology, keynote prescriptions, repertorial analysis, and anti-miasmatic medicines are effective in post-COVID mental disorders. Anxiety, fear, and restlessness are the main indications that lead to the prescription of arsenic album in as the leading medicine in our case series. Ignatia amara is prescribed based on the symptoms developed due to the impact of trauma, grief, and sadness. Other medicines were prescribed according to the individualized symptoms. Different type of fears, as already mentioned, the fears. Those fears definitely helped us for the selection of the medicine. And certain delusions were there in these patients, and delusion of duality and certain dreams like falling into water, falling from mountains, dead persons, misfortune, etc. are also was very important in the selection of our final selection of the medicines. While coming to the literature review, arsenic album, ignatia, and calcareous carb are among the 5 highest ranked medicines mentioned in the retrospective analysis in the research article Psychological Implications during COVID-19 and its homeopathic management, published in the IJRH recently. This is an article. The authors of this article are Dr. S.K. Murthy, Dr. Rathika, and Muralidharan. They belongs to the Department of Psychiatry, National Homeopathic Research Institute of Mental Health, Kottayam. According to them, the 5 important medicines for the post-COVID mental disorders are arsenic album, ignatia, calcareous carb, pulsatilla, and lachesis. In our case series also, arsenic, ignatia, and calcareous carb came as the most important medicines for this treatment. The average time taken.
Sorry to interrupt, Dr. Jitesh. We need to wrap up in the next 30 seconds.
Sure. The only few words more. The average time taken for recovery is 7 weeks. This 7 weeks average recovery time is also a significant outcome, because in the COVID scenario, the first 3 weeks is considered as COVID illness. From 3 weeks to 8 weeks is considered as post-COVID period, and any symptoms which is carrying forward above 8 weeks is considered as long COVID. So from our observation, these cases were treated within the period of 8 weeks, and the average time span we took is 7 weeks. So the patients got relief within the period of post-COVID period. Rather, they will not develop the long COVID cases. In conclusion, of this case series significantly showcased the usefulness of homeopathy treatment in post COVID-19 mental disorders. But anyhow, it is a very small sample we had taken. So definitely there is a need of randomized control trial for further analysis. And lastly, I thank our director, Dr. Rajkumar Manjanda, for giving immense support and guidance for our case series. And also, I thank my co-authors, Dr. Amit Arora, Dr. Kavita Sharma, Dr. Prateek Kumar, Dr. Cheshta Nagarath, Dr. Shruti Gora, Dr. Utesh Kumar, Dr. Rahul Vardhan, and Nasya Nikat for their immense contribution. And lastly, I thank Dr. James Michael of CCRH Delhi, and Dr. Mahesh Ketty and Dr. Sharin Balan of Directorate of Ayush for giving us support for this compilation and data collection of this case series. Thank you all. Thank you for giving me an opportunity to present the presentation here. Thank you.
Thank you, Dr. Jitesh, for the very nice presentation and taking up this such an important topic for discussion. Now, I would like to ask our chair, Dr. Rajat Chattopadhyay, if he has any questions to ask. Sir?
Not just only one question. It's a fine presentation, Dr. Jitesh. Just one question that you are repeatedly talking about fear and anxiety, but aconite or opium, what is very common drug of our Metro Medica, that not come at this study probably. I have not seen. So what is your experience about that?
So, sir, definitely aconite is a very good medicine, but as my and after individualization, we have selected these medicines. Arsenic, ignatia, and all, because considering other symptoms,
Okay. In your case series study, you have not found out all those. It may come out the later on.
Definitely, that will help help anyway. So,
Okay. Thank you, Dr. Jitesh.
okay.
Thank you, Dr. Jitesh, and thank you, Dr. Rajat. Now, I would like to request Dr. Thankraj to kindly take the session forward.
Thank you, Dr. Cheshta. Now, with the permission of the chair, I would like to invite our next speaker, Dr. Momita Chakrabarti. Dr. Momita Chakrabarti is a Senior Medical Officer at the Directorate of Ayush, Government of Delhi. The topic of presentation is an observation study on the effectiveness of homeopathic medicine, Naxomica, to combat the side effects of liposomal amphotericin injection in the cases of mucormycosis. Over to Dr.
Good morning. A very good morning to you all. Myself, Dr. Momita Chakraborty, Senior Medical Officer from Directorate of Ayush, presently posted at Guru Tegh Bahadur Hospital, Delhi, India. Now, I am going to present an observational study on the effectiveness of homeopathic medicine Naxomica to combat the side effects of liposomal amphotericin B injection in the cases of mucormycosis. Now, some briefing of mucormycosis. Mucormycosis is a antifungal disease and caused by the fungus called Mucormycetes. And the most common type of mucormycosis, what I have seen during my work at GTP hospital, it was ROCM, that is rhino orbitocerebral mucormycosis. These are the common presentation of mucormycosis, that is puffiness of nose, pain in cheek, redness in eyes, pain in eyes, vomiting, weakness, etc. And the main treatment for mucormycosis was first is intravenous antifungal drug injection and surgical de-debridement. FDA recommended liposomal amphotericin B and isobucanazole as the primary treatment of mucormycosis. Now, this is the most focused portion of this study, that is the side effect of amphotericin. These are fever, shaking, chill, nausea, vomiting, loss of appetite, headache, profound weakness, unusual tiredness, pain at the site, etc. And as we know that strychnine and brucin is the most common alkaloid which antidote the side effect of chemical and vegetable drugs, and this is the site of affection of Naxomica on the GI tract. And the most common symptoms are nausea, vomiting, and other dyspeptic complaints. Aim of the study was to observe the effectiveness of Naxomica to combat the side effect of amphotericin injection in case of mucormycosis. And the objective was to improve the condition of the patient and enable them to continue the record conventional treatment with amphotericin. Study site was in GTP hospital. It was an open label observational study. We have taken 4 months and sample size 55, and all samples were included on the basis of inclusion and exclusion criteria. Inclusion exclusion criteria same for all the study. I'm skipping it. And this is one of the important things, that is the selection tool. I have selected case taking pro forma, gastrointestinal rating scale, and consent form. And I would like to elaborate what is GSRS scale. GSRS scale is a disease specific instrument of 15 items combined of reflux, abdominal pain, indigestion, diarrhea, and constipation. And the GSRS has 7-point graded Likert type scale, where 1 represents absence of troublesome symptoms and 7 represents very troublesome symptoms. It was used after taking permission from the authority, that is AstraZeneca. Intervention Naxomica 30 TDS was given for continued for 15 days, starting from first day of administration of amphotericin B. And data analysis and outcome was done after comparing GSRS questionnaire scores before and after the study using paired t-test at 5% level of significance. GraphPad software were used for statistical analysis. These are the observations, that is all cases were post-COVID and diabetic, maximum affected age group at 40 to 60. Male were more affected, 69% were male. More common symptoms, nausea, bloated abdomen, constipation. This is the graphical presentation. And this graph representing GSRS score before, that is the GSRS 1, which is indicated here as a red line, and GSRS 2, that is the after the treatment, which is indicated here as a blue line. You can see the difference, and between the two, out of 55 cases, 42 showed marked improvement, 7 very less moderate improvement, 2 no improvement, and 4 patients were worse. And this is the among 101 cases, 82. This is the worldwide systematic review. Among 101 cases, 82 are from India. This is really very sad and depressing. The study showed the effectiveness of homeopathic medicine Nux vomica, which improves mental as well as physical condition of the patient. Now, in conclusion, I want to say that the study indicates the Nux vomica is possibly effective medicine to combat the side effect of mucormycosis and enable the patient to continue the required treatment and their speedy recovery. Although further studies are required to with control group for the validation. And ROCM, worldwide distribution, and I would like to conclude with the note of Alan's keynote, that is Nux vomica is one of the best remedies with which to commence the treatment of cases that have been drugged by mixture, bitter, etc., but only if the symptom correspond. So Nux vomica was used and good results were obtained. These are my annexure, that is case taking pro forma. This is the GSRS questionnaire. This is the consent form. And I want to end up with this slide, that is it is evident from the study result of paired t-test that the study result is highly significant. The outcome of study is establishing with the fact that the combined effect of medicines of different pathies achieve results which may not be possible with the help of only one system of medicine. Thus, we, the fellow who have taken Hippocratic oath to serve the humanity, should make such more combined efforts. That is, the doctors from the alternative medicine and modern medicines should join their hands to give desired relief to suffering humanity. With this, I would like to convey my sincere thanks to Dr. Manchanda sir for his constant support and motivation. And my special thanks to my research associate, Dr. Purnima Rani, for preparing this, all the technical problem and research and biochemistry related to this study, to GTP Hospital for giving us the permission to see and treat the patient, and to the LMHI team. Thank you so much for listening me patiently.
Thank you, Dr. Momita, for the presentation. That indeed an example of integration of various systems and how it is helping the humanity. Now over to you, Dr. Redshed. So we'd like to ask questions to Dr. Momita. Dr. Redshed.
Hello.
Yes, sir.
Hello.
Yes, sir.
Yeah, I just, Dr. Momita, it was wonderful. It is unique one in itself. But one thing I just confused in the last part of the conclusive part, whenever you talked about the integration of the medicine, then you were admitting that the side effect of the medicine used in mucormycosis. But again, for the removal of the side effect, you advise, you applied Nux vomica and it was effective in your small study. Whatever, it may be very small study, but in the long run, it may go further. So whether this is the integration,
integration that I want to say that to give giving amphotericin B was certain. We didn't have any choice to go without amphotericin. So it was certain, and the hospital authority called me that because for administering amphotericin, the
Yeah.
height, weight, and minimum vitality is of the for the patient is required to endure the effect of amphotericin. So after
Okay.
taking one dose or two dose, it was found that the patient becomes so much weak, and so they have to stop the administration of amphotericin.
So as an emergency medicine, one can use in the very emergency condition, but for the removal of the side effect,
Side effects, I
ma'am's
have
Bhumika may be effect. May
effective.
yeah, maybe
Yes.
very much effect. Okay.
Yes. Okay. Thank you, sir. Thank you, sir.
Thank you, Dr. Momita, and thank you, Dr. Reddy.
Thank you.
Our next speaker of today's session is Professor Dr. Neeraj Gupta. Dr. Neeraj Gupta is the head of postgraduate department of Organon of Medicine at Nehru Homeopathy Medical College and Hospital, New Delhi, India. And the title of his presentation is A Comparative Retrospective Comprehensive Analysis on the Impact of COVID-19 on Mental Health in COVID-19 positive patients during two different waves in India. Over to you, sir.
Hello, good afternoon, everyone. Am I audible?
Sir.
And my screen is visible?
Yes, sir.
Yeah. So as the title goes, we started investigating a comparative study, which was a retrospective and comprehensive on the impact of COVID-19 on mental health, especially in COVID-19 positive patients during two different waves in India. The first wave, which came last year in 2020, and the second wave, which came this year somewhere in March, April, and lasted till May. So this was a kind of study which we thought of doing. This is not an interventional study. As we are all aware, coronavirus disease 19 has caused immense loss of human life and has proved to be a significant health emergency and made life disillusioned and confused globally. All the scientific communities globally had been working together to find out the ways and means therapeutically, the management part, and many things. The objective of our study was to evaluate the impact of COVID-19 on mental health among the COVID-19 positive population of India. We took up 4 hypotheses that there lies no difference in depression, anxiety, and stress levels of COVID positive patients between two waves of COVID-19, because depression, anxiety, and stress, they were very commonly found out. Second hypothesis, there lies no difference in impact of COVID-19 event on COVID positive patients between two waves. Third was, there lies no difference in post-traumatic stress levels in COVID patients between two waves of COVID-19. And lastly, there lies no difference in psychological health in COVID positive patients between two waves of COVID-19. Material methods, we took about 954 total subjects of both sexes and age groups between 15 to 80 years who were analyzed retrospectively from the COVID health centers of Nehru Homeopathic Medical College and Hospital and GTB Guru Tegh Bahadur Hospital, Delhi, by our psychiatry OPD of NHMC, Defense Colony. The tools, the scales which were used were 4 psychological scales, which are standardized scales used globally. First was impact evaluation scale revised, having 22 questions. Second was patient health questionnaire 9, having 10 questions. PTSD checklist civilian version. There are 2 versions. One is military version, but which is used in military, but we took civilian version, having 17 questions, and DAS 21, which covers depression, anxiety, and stress, having 21 questions in it. Now, this is a graphical representation how we saw the both waves, COVID-19 first wave and COVID-19 second wave. The data collected in the first wave was about 402 patients total, and dropouts were about 102. The effective sample was 300, and the male and female ratio was female was 106 and male was 194. And the second wave, we collected about 552 cases. There were dropout of 202 patients. Effective sample came out to be 350. Female 161 and male 189. This is what we can see in the pie chart, the same thing. The red marking triangle, basically 102 were dropped out in the first wave and 202 were dropped out in the second wave. This is IES, that is impact of event scale revised first wave and second wave comparison. In the first wave, we got total number of cases about 288 having no clinical concern. The score was less than 24. It was about 96%. 8 subjects we got about clinical concern where the scoring was 24-32. And 2 cases in total, about 0.66% we got about probable diagnosis of post-traumatic stress disorder where the score was between 33 to 36. And 2 patients which had gone to immunosuppression where the score was about more than 37, coming out to be 0.66% in the first wave. In the second wave, about 336 patients were having no clinical concern, 96%, same, it is coming almost as we compare with the first wave. And 14 cases we got about for clinical concern, about 4% of the case, and PTSD hardly anything we got. And the last category also where the score we could not get more than 37, it was 0%. PHQ-9, that was the patient health questionnaire. PHQ-9, which contained 9 questions. In the first wave, we got about total number of normal cases, 118, 39.33%. And minimal effect came out to be on 141 patients, 47%. Moderate effect was seen on 38 patients, 12.67%. And severe, 3 cases, about 1%. In the second wave, PHQ scoring went as normal 61, 17.42%, minimal 234 cases, about 66.85%, moderate effect was seen on 54 patients, 15.42%, and 1 was severe, about 0.28%. PTSD scoring was also done comparatively in both the waves. And in the first wave, it was total number of cases of 278, having a score between 70 to 29, which said that little or no severity. It was about 92.67%. 1 case was about showing some PTSD symptoms, 0.33%. Moderate were about 19 cases, 6.33%. And high severity of PTSD symptom, where the score was 45 to 85, was about 2 patients, 0.67%. In the second wave, simultaneously, we could assess total number of cases, about 329, where we had little or no severity, 94%. Some PTSD symptoms were found in 4 patients, 1.14%. Moderate was found in 17 cases, 4.85%. And high severity of PTSD, we could not get any. Similarly, in DAS scoring, DAS, which covers depression, anxiety, and stress simultaneously. In the first wave, normal, we found about 280 patients, 93.33%. 14 were considered to be mild, 4.67%. 3 were moderate, 1%. 1 was severe, 0.33%, and 2 were extremely severe, about 0.67%. And the second wave, we could get normal 306 patients, about 87.42%. Mild 10 to 13, the score was between 10 to 13, 30 patients, about 8.55%. Moderate was about 14 patients, 4%. Severe was hardly, and extremely severe was hardly. Same, especially the depression. Among the anxiety, DAS anxiety, in the first wave, we got about 252 patients, which constitute about 84% having normal, showing no anxiety levels. About 12 cases, about 4%, they were showing mild anxiety, and 29 showed moderate anxiety, 9.66%. And severe anxiety was found in 2 patients, about 0.66%, and extremely severe, 5 patients, which was about 1.66%. And in the second wave, total number of normal cases which hardly showed an anxiety was 298, that was about 85.14%. Mild cases of anxiety were 21.6%. Moderate levels of anxiety was found in 30 patients at 0.55%, and severe anxiety was found in one patient, 0.28%, and extremely severe was hardly found. The stress domain, we assessed that also and compared first and second wave accordingly. In the first wave, we got about 279 normal, hardly any stress, 93% constituted. 19 patients were about mild, which were constituted about 6.33%. One was moderate, 0.66%, and one was severe, 0.66%. Hardly any extremely severe anxiety was found in the first wave. In the second wave, simultaneously, 322 cases were normal. They did not show any stress levels, about 92%. Mild were about 21 cases, 6%, 7 moderate, 2% severe was, and extremely severe was minimal, or extremely not there at all. Now, this comparison we could do, and statistical analysis, we found that we applied chi-square test, which was used to calculate p-values. On calculation, the chi-square statistics for PHQ-9, that is Patient Health Questionnaire 9, and DAS-21 were found to be 41.3962 and 13.322 respectively. The corresponding p-values which were assessed was less than 0.0001 and 0.0098 respectively. Hence, the result was found to be significant, which was at less than 0.05 p-value. However, no such significant difference was reflected in data regarding post-traumatic stress disorder and IES revised score. Statistical analysis of data showed that COVID-19 has produced considerable impact with respect to depression, anxiety, and stress on Indian subjects. This basic population, whatever data we had collected, was from Delhi, which is capital of India. So a small sample was actually available. So whatever study which we could do, we have shown as a result. The anxiety apparent in first wave can be attributed to novelness and little knowledge about the coronavirus, because nobody knew what this coronavirus is and what it would cause. So anxiety was very much apparent, and our result also showed that. However, post hoc analysis confirms that p-value for DAS-21 and PHQ-9 in the domain of depression is found to be significant in second wave, which shows that impact of COVID-19 was higher with respect to depression and psychological health during second COVID-19 wave, which came in India somewhere starting from March end or April beginning and lasted for 2-3 months in 2021. The conclusion, what we could get was, the inference is that COVID-19 had produced higher impact in terms of depression and altered psychological health during second wave as compared to COVID first wave. This may be due to increase in infectivity. We could, all of us know that there was high infectivity because of the Delta variant. The morbidity was high and the mortality was very, very high as compared to the first wave during second wave of this year. But however, no such conclusions could be made with respect to post-traumatic stress disorder. We extend our sincere thanks to COVID health centers of LMHI and GTB Hospital Delhi to have provided the list of COVID-19 positive patients who willingly participated in this study, and the JRs and interns who were involved and in the helping of collecting the data. And above all, we thank LMHI, the coordinators, and our colleagues who have worked with us, especially our co-authors, Dr. R.K. Saxena, Dr. Shwetangi, Dr. Ravinder, and Dr. Swati, who were able to help us in the collection of data, and many other interns from the psychiatry OPD who were actually briefed about how these scales have been were to be used, and they did excellent well. Thank you very much.
An unseen mental health emergency is sweeping across the world like COVID-19, like a silent pandemic. Very relevant topics, sir. Thank you for the presentation. Now over to Dr. Rajat. I'd like to ask some questions.
A nice presentation, Dr. Neeraj, and wonderful approach to all junior doctors, inspiring. Very good. I have one question, that a patient health questionnaire, whatever you have made, whether it is validated, one, and second one, that is your dropped out cases in the second, in the dropped out cases in the second wave is double than first wave. But you have shown that in the second wave COVID-19, you have you got the result or whatever you have established more in the second wave, but your dropped out cases are more in the second wave in comparison to first. So these two are now.
Yes. Patient health questionnaire, which has been used, sir, it is a standard questionnaire which has been used because it covers the patient total health, not only the psychological but physical health also, because it contains 9 questions. About 5 questions are pertaining to mental health and 4 questions pertain to physical health. So that is how it is being taken up. Secondly, the question of the dropout rate being high in the second wave, because the sample size was high, sample size was more. So dropout cases were obviously in proportion to that. Yeah.
Okay, thank you. Thank you. Only the questionnaire may be more validated because I think you will be in further this type of study, it will be more with more sample study, you will be continuing at your institute. So
Certainly.
the questionnaire may be more validated questionnaire. It will be better for publishing paper.
Certainly.
Okay, nice, Dr. Davis. Thank you.
Thank you.
Thank you, Dr. Neeraj. Thank you, Dr. Rajat. Our next speaker is Dr. Ram Choudhary, AB, from Adhurashram NSS Homeopathy Medical College, Kottayam, in Kerala. The title of presentation is Insomnia in Long COVID-19, Treated with Homeopathy Case Series Study. Over to Dr. Ram.
Respected chairperson, moderators, coordinators, and fellow presenters, a warm good afternoon to all. I am presenting a case series of 24 cases of insomnia in long COVID, which is treated with homeopathy. The background, the pandemic has brought as a wave of new chronic or disabling condition called long COVID that deserves serious attention among scientific and medical communities to resolve. A study published by Lancet Psychiatry finds that insomnia may be one of the most common neurological and psychiatric outcomes of COVID-19. The homeopathic medical system has clear guidelines for the control on infectious epidemics. It is well established in long before the advent of modern sanitation, vaccination, and other antibiotics. The aim of this study is to describe a series of 24 long COVID-19 patients who underwent homeopathic treatment for insomnia. Actually, these case series are taken from an observational study of long COVID cases with a large sample. Objective to understand the effectiveness of individualistic homeopathic treatment in reducing insomnia in long COVID. The source of the data, cases attended post-COVID clinic of Adhurashram NSS Homeopathic Medical College, Kottayam from June 2021 to September 2021. The data was collected in a specialized designed questionnaire for long COVID cases. The valid rating or grading scale, that is insomnia severity index, is used for diagnosis and outcome. So the diagnostic or outcome assessment index, that is insomnia severity index, it consists of 7 questions with 5 grades. So these are the assessment insomnia severity index, and it consists of 7 questions, 7 grades are added up to get a total score. The total score are categorized as 0 to 7, that is not clinically significant insomnia, then 8 to 14 subthreshold insomnia, 15 to 21 clinical insomnia, and 20 to 28 clinical insomnia, that is severe variety. Therapeutic intervention, individualistic homeopathic medicine was selected based on symptom totality. Optimum potency and dose repetition of medicine was determined by assessing the susceptibility and the nature of the disease. The simillimum was prescribed and follow-up assessment was done at every 2 weeks. So these are the cases. So case 1. So I have given the leading indications, and we follow the physical generals and characteristic particulars for indications for a right remedy. And if mental generals are available. If it is significant, we are considered. And the first case responded well to Gelsemium 200. The characteristic drowsiness and dull aching pain with thirstlessness was present. Then Naxomic 200 was present to the second case with sleeplessness of early morning and appetite reduced, yawning was there. Natramur 10 was prescribed to the third case because of post-COVID depression, and there was intense fear and dreams of robbers, and because of that the patient was sleepless, and there was loss of smell after COVID. Now coming to the next case, which is given arsenicum album 1M. Disturbed sleep with restlessness, anxiety about health, shortness of breath, unable to lie down, thirst, increase for warm drinks. So these are the indications. Next, again, RSALP 200 was given 7 dose, 1 dose on alternative days because of the severity of the symptoms, like breathlessness was severe, and it was aggravation by lying down, even walking. Thirst was increased, sleeplessness with restlessness. Then next case respond to Naxomic 200. There was a hiccup during the night with chilliness and aversion to food. So these are the indications for that. Now next one is arsenicum album. Again, next case respond well. Then the indication was breathing difficulty with pain in chest, aggravations, night, heartburn, sleeplessness with restlessness. And arsenicum album was indicated in most of the cases. Then next case responds to lactasis 200, sleepiness but cannot sleep, heat sensation was the aggravation at night, breathing difficulty, again aggravation at night, restless with palpitation and trembling of body, and aversion to covering or aggravation by covering. So that was indications for lactasis. The next case respond to arsenicum album, sleeplessness after a short sleep, anxiety about health, shortness of breath, unable to lie down, and thirst increased. So these are the indications. Now next, so I am skipping these slides because there are 24 cases with different indications, and majority of the cases responds well to arsenicum album, and there are other medicines also. So this is the overall outcome assessment, post-treatment, pre-treatment, and post-treatment. And the cases, for 3 cases having significant insomnia, 17 cases of sub-threshold insomnia, and 4 cases had insignificant insomnia. But all respond very well to homeopathic treatment. And after the treatment, there was no significant insomnia. So there was a significant reduction in the score. Interpretation, the severity of the insomnia before intervention shows that 12.5% patient have moderate, significant, moderate clinical insomnia, 70%, 17.8% have subthreshold insomnia, and 16.7% have no significant insomnia. After homeopathic intervention, no significant insomnia seen in patients. So this was a significant reduction in the score, and these are the medicines given: arsenicum album, Naxomica, Gelsemium, Natramur, Carbovage, Bryonia, Restox, Lactasis, Pulsatilla, Phosphorus, and Aconate. So the current study provides a preliminary evidence that homeopathic treatment is effective for insomnia in long COVID-19 patients. Further, large-scale, robust study designs are required to draw a valid conclusions. So my acknowledgement to Professor Dr. P.K. Sudhir, Honorable Vice Chancellor, Vinayaga Mission University, South India. Thank you all.
Thank you, Dr. Ramjyotis, for that very interesting presentation. Now over to Dr. Rajat for 6 minutes.
Yeah, wonderful presentation, Dr. Jatish. I have just one question, that whether arsenicum album here you got good result, but it was chosen on the thoroughly on the basis of individualistic concept, or from the purpose of genus epidemicus, whatever, chosen on the basis of that, or here arsenicum album chosen on the basis of individualistic concept? To
Yes,
Dr. Jatish. Yeah.
Arsenicum album was chosen based on the symptom picture. So whatever available picture presented to us. So sometimes, most of the cases we have seen that fear and anxiety in the night.
Yeah.
And there was intense thirst, and fear of death was there in some cases. Even in one case, we have given aconite because the fear of death was so intense. So we have not given importance to arsenicum album. We have given aconite.
Is there any specific questionnaire for this all participants and validated?
Yes.
Yeah.
Because that's why I told it was a part of a observational study for a large sample size. So we have designed a specific questionnaire for post-COVID cases. Along with that, for each symptoms like insomnia severity index for insomnia, then breathlessness dyspnea scale was there. So for each symptoms we have a separate scale.
The questionnaire also in the regional language it was translated, or in the English only? The questionnaire
is in English, and in our college, our interns are taking the case of they themselves have read, and they translated to patient, and they recorded the case sheet.
Okay. But whenever you will be taking more sample, more large sample, and it will be at your area, so it will be preferred you also use the questionnaire in regional language and make it validated. Then the authenticity of this will be much more better for publishing papers. So this is my suggestion. Wonderful presentation. Okay, thank you.
Thank you, Dr. Rachid. Thank you, Dr. Ramchand. Now, we call upon our last speaker of today's session, Dr. Himabindu Ponnam. Dr. Himabindu is a research officer and the scientist grade 3 at the Central Council for Research in Homeopathy, Hyderabad. The title of presentation is Optimization of Homeopathy in the Management of Post-Traumatic Stress Disorder and Aftermath of COVID-19 Pandemic, a clinical case series. Or to Dr.
Is my screen visible?
Yes, doctor.
Yeah. At the outset, I would like to extend my warm greetings to the chairperson, Dr. Rajat sir, and the moderators of the session, my co-speakers, and all the delegates. And I would like to thank the organizers of the LMHI for making this global association possible with this conference. My presentation topic is Optimization of Homeopathy in the Management of Post-Traumatic Stress Disorder and Aftermath of COVID-19 Pandemic, a clinical case series. Coming for 2 years from now and to still continue, we all have been stuck up in the mess of the pandemic. And the psychological implications of the pandemic are posing a major public health concern. And the consequences of the pandemic left human life, as we all know, in utmost trauma, and the most common manifestation of this impact is what we call as post-traumatic stress disorder, and which is aptly can be called in the present scenario as a post-COVID stress disorder. And as all my initial speakers have already spoken about, there are various innumerable fears and stress felt by the people in the pandemic, which led to these manifestations of the PTSD. And among the innumerable reasons for this PTSD manifestations, fear of contracting COVID-19 infection, the shock of the quarantine and isolation, social stigma, loss of the near and dear ones, and even many women have experienced domestic violence and sexual abuse experiences due to these prolonged lockdown conditions, and fear of financial crisis, as we all know, because there are most of them were jobless in this pandemic period. So these manifestations may lead to the post-traumatic stress disorder, and if this condition is unidentified and untreated, definitely there is a chance that it will lead into chronic suffering of the traumatic experiences, and also there are chances for transformation into grievous psychotic states, posing its management a challenge to the medical fraternity. So it's a very major public health concern post-COVID. And coming to its prevalence, I just illustrated a single study, but there are many surveys done during this pandemic and to elicit the incidence of the post-traumatic stress disorder. And it was found that about, even though the global incidence is told to be 7%, but during these acute disasters, traumatic events, the incidence rises. And now during this pandemic, it was seen that 28.2% is incidence as this post-traumatic stress disorder cases. And previously, post-traumatic stress disorder was controversial, but the diagnosis of this disease is very controversial, but the release of the Diagnostic and Statistical Manual of the Mental Disorders, DSM-4 and DSM-5 in 2013, had led to a definite diagnostic criterion for differentiating it from other neurotic states. So they have laid down 8 criterion in this DSM-5, very clearly distinguished ones, so that we can diagnose a case very easily. The criterion A is traumatic event. I would not go into all the criteria, but the criteria B, C, D, E are the main cluster symptomatology of the post-traumatic stress disorder. My first speaker, Dr. Aditi, has already explained the cluster symptomatology. So these are the 4 important cluster symptomatology identified in these PTSD cases. And so the clusters, if identified, the case would be diagnosed as a PTSD. And further to confirm this diagnosis, there is a scale, clinician administered PTSD scale, which is commonly called as CAPS-5, and it is very widely used. It has been given and validated by Weather et al., and it is meant as the gold standard for the diagnosis of the PTSD cases. This questionnaire has 30 items, and 20 items cover the outlined PTSD clusters, which I have shown you, the 4 clusters, and the 10 items explore the onset, duration, intensity, and the frequency of the symptoms. And the score is like this. If it is 0 to 20, there are no symptoms of PTSD, 21 to 29, mild symptoms, 30 to 49, moderate symptoms, and 52 to 86 are severe symptoms of PTSD. So this is a very widely used scale to confirm the diagnosis of the post-traumatic stress disorder cases. And I have taken up, even though I have treated almost around 50 cases from the first and the second phases of the pandemic, but I have represented here only the summary of 10 cases because these cases followed very meticulously, and still now I have their follow-up with me. So almost they have undergone the first and second phase of the pandemic. I had them follow-up till now with me. So these cases I have summarized here. So as I said, they were evaluated with the CAPS-5 scale, and case was taken as a totality, and totality was built and repertorized, and in consultation with the medical medicine was selected. First, initially for the first month, weekly follow-ups were asked for the patient, and after that every month, and CAPS-5 every 3 months the CAPS-5 was administered and evaluated. So till 6 months I followed, and at the end of the 6 months the score was again, CAPS scale was again administered. And at the end of the 1 year, I administered the Monarch tool, that is a modified Naranjo criteria for homeopathy, to assess the causal attribution of the homeopathy for the outcome. And this is a process which I have used for treating these cases. And coming to the results, the cases which I had more of the female cases, 6 cases for female cases and 4 were the male cases. And this is the age criteria which I have received. And the useful homeopathic medicines which were found were initially, for the first initial acute manifestations, I had to give up acute remedies like aconite, argentum nitricum, coffea cruda, veratrum album, and Pisidia mother tincture in some cases. And all the potencies were used in 200, 1M, and 10M potencies. So initially for the acute manifestations, I went up with the acute remedies. And once this acute symptoms subsided to a moderate level, then I had, in the meanwhile, I had proceeded for the total case taking with the patient and along with the attendings. And in evaluating the case with the CAPS-5 scale, clinical psychologist has helped me out, and she has evaluated the CAPS-5 score. And the other constitutional remedies which I have prescribed for these cases are Naxomica in 2 cases, arsenic album in 1 case, aurum metallicum in 2 cases, ignatia in 1 case, lycopodium in 1 case, and natriumur in 3 cases. So these are the remedies which I have prescribed. In the summary of the 10 cases, initially the score of CAPS-5 was like all were almost severe cases. Only 1 case was 51, that is the moderate, falls in the moderate level. And after 6 months, the almost 8 cases were no symptoms of PTSD, and only 2 cases had mild symptoms. And all these cases were followed up till in the second phase of the pandemic. Also, they were with me follow, and I was very much happy that these people could cope up in the second phase. They all had faced different situations, like they lost their dear ones. Even 2 of them has contracted COVID-19 infections. The most stressful things they have all faced again in the second phase, but the severity of the manifestation of PTSD was not there as I have seen in the first wave with these patients. They were very well coped up with our medicines, and the second phase they could go up very well, and they coped up themselves very well with our medicines. So this is just a single chart to show how I had taken all the totality of the symptoms to find out the individualized medicine. And my habit is, when I prescribe the medicine, individualized medicine, I consult Haring's guiding symptoms. So one thing which I came out in the while I was consulting the Haring's guiding symptoms was, but the symptoms are very meticulous. I could find the DSM PTSD clusters even in our Metromedica. This really amazed me. One single example I would like to show you. That's why I had put this slide. Naxomica and the Haring guiding symptoms. You can see 3 months ago, the patient has underwent the mental shock, and from then the symptoms started. So really, it proves that homeopathy is a medical science ahead of its time. PTSD was identified, this nomenclature has come up only in the 1980s. Previously, it was named as fight neurosis, traumatic neurosis and all. But clear picture of it was only given in 1980. But the then Metromedicas of our Metromedicas written in 1879, 1811, Metromedica Pura, you can find these symptomatologies. So this itself illustrates the magical outcome of the meticulously conducted homeopathic pathogenetic trials and drug proving done by our masters and his successors with utmost precision, which even holds good at any point of time. This shows really the homeopathy is a medical science ahead of it. And we have the responsibility to upgrade our literatures with the modern nomenclature. And this is my experience with treating the PTSD cases. And I think as homeopaths, we all are blessed with a special boon to treat psychological disorders. We possess a blend of components within us as a psychiatrist and a psychologist. As a Hahnemannian trait within us, I would like to say. That is, we prescribe and also we give the sensible advices and what Hahnemann has had, friendly exhortations to the patient. So this definitely are a good thing. And during the pandemic, I will tell you, there is no psychiatrist available for consultation and no psychological counselings were available because they are not well doing along with the video consultations, and that could not be possible. So what is the source of treatment and source of help is only our homeopaths. So I think that we have an immense responsibility in this present scenario. It would be not an exaggeration if I say that the homeopaths, as homeopaths, we have an immense responsibility, and we can be the saviors of human life from the psychological impacts of the pandemic. And our dedication should be on in this way because we have an opportunity. So thank you all. Thank you for the patient listening. And I would like to thank my team, that is the clinical psychologist who helped me out in assessing the scales, CAPS-5 scales. And during this venture into this disorder, treating this disorder, I had an opportunity to take up this topic further into a PhD thesis. And Dr. Gaurana Arji is my guide, and he helped me out to take up this topic. So I thank my team for helping me out. Thank you. Thank you very much.
Thank you, Dr. Himabindu Punam, for that wonderful presentation. Now, Dr. Rajat, would like to ask some questions and clarification from him.
It's a nice presentation, Dr. Himabindu Punam. She is very sincere approach. One thing is good, that is Naxomica, which also she mentioned. I will only ask that whether the using monarch skull in this type of PTSD, post-traumatic stress disorder, whether this is the first time the using of Monarch scale is this type of the assessment for post-traumatic stress disorder, or whether you have gone through many type of literature review or this type of similar work have you gone through?
No, sir. No. There was one paper on psychiatric validation of the psychometric validation of the Monarch scale by Dr. Saha, but I did not find any other papers.
So it is too early for assessment.
No, sir. No. That's why I waited for 1 year. Even though the CAPS-5 score has come to a normal within 6 months, that's why I have only presented those 10 cases which I had 1 year follow. So at the end of 1 year, after the second phase, recently in October, they have completed the 1 year. So I could validate only at that time, I could administer this Monarch tool.
Okay.
And
that's why you were talking about the Naxomica, how wonderful Mathematica. But you can remember that the Naxomica and Ignatia are cognate. They are also they are very good close. And also Netramur is the chronic of Ignatia.
Exactly.
So your Netramur case is 30% is the mostly, and it is probably in the second phase you got the most result, the second COVID phase. So Netramur is most effective. So it's a good one. Good one. It may be a another one research project we may think of in the long run with much more samples.
Yes, sir. I'm exploring with it as a PhD thesis, sir. I'm working on it as a PhD work.
Okay. Okay. Carry on. Thank you.
Thank you, sir. Thank you.
Thank you, Dr. Himabindu. Thank you, Dr. Rajat. So that was our last speaker session. Now the floor is open for discussion. And if any panelists would like to ask any questions or comment on the papers presented, please ask.
One thing which I must mention, that most of the whoever presented on the post-traumatic stress disorders, insomnia, whatever, in the second wave, Dr. Neeraj, Dr. Hima, all those, they have mentioned that they got more result in the second wave. It is a very wonderful outcome of this discussion. And also we have very good data that homeopathy may be very much effective, and also statistically improvement in the assessment. Monarch scales have been used in the statistically improvement in two or three presentations. We have got the efficacy, the statistical efficiency in the homeopathic medication. So these are good outcome, I must think.
Is there any more questions or any comments from any of our panelists?
I have a question from all the panelists, like with their experience of post-traumatic stress disorders or the mental conditions that develop post-COVID, was there any correlation with any specific personality types or any specific miasmatic types which were more prone to develop the post-traumatic or post-COVID mental symptoms or diseases?
Well, I would like to answer this question, Dr. Cheshta, very well asked. As we know that psoric individuals are basically more sensitive, ultra sensitive, I would say. So in our assessment of these post-traumatic or whatever we can understand, so these individuals are highly susceptible, highly sensitive, being sensitive because sensitivity is very high, so they express very fast. So their expression of symptoms comes as very fast. So that is what I would like to say as one of your questions. Thank you. I think you have cleared that.
Thank you, Dr. Neeraj, for the answer. Anybody else or any other panelists would like to add something to this discussion?
Yeah, definitely. They are all psoric manifestations, because of the sensibility only. That is the reason where the cases of PTSD, post-traumatic stress disorder, has raised during this pandemic. So the more highly sensitive people are mostly affected with the trauma.
And
Mostly
that's
the-
why even people seeing others suffering, they were reacting.
Exactly,
It was not
exactly,
necessary that they themselves suffered,
Exactly.
but even seeing others suffering, they were reacting.
exactly. Yeah.
Thank you, ma'am, for your valuable input.
I think all of our panelists should coordinate to develop a common protocol for this type of post-traumatic stress disorders. So that
some
mentally
standard
help and
treatment protocol.
standard treatment should be formulated. Very interesting session. So let me conclude for now. I think no more questions.
And sir, let's request everybody to switch on their cameras so that in there we
Yeah.
could have a nice group photograph too.
Yes, sir. So to conclude, I would like to express my gratitude to Dr. Rajat to take out some time from his busy schedule to grace this occasion. Thank you, sir, for your valuable and inspiring. Thank you. I extend my gratitude to all the speakers of this session for their presence and their contribution, which made this session a big success. Thank you, Dr. Cheshta, Dr. Srishti, and Dr. Gauri for coordinating everything and ensuring flawless. Who is the stage manager, Surbi? Can we have a group photograph? All of you, request to please switch on your camera.
Yes.
Thank you, Dr. Thankraj. You also chaired the session very nice. Dr. Rajat also, and Cheshta, everyone. So on behalf of the speakers, I would like to welcome and thank you, whosoever was attached, associated. Thank you.
Thank you everyone for this wonderful session. So with this note, we will conclude the session for now. Thank you so much, everyone.
Thank you all.